Okay, everybody is in. So I've been trying to automate the Zoom calls to practice better so they just go there and I don't have to do it in the morning on Mondays. And I don't think it's working because I'm getting messages that where's the Zoom call link? So I'm sorry if you didn't get it. I manually like hit send reminder. So I'll just go back to doing it manually for like, well, even though we only have one more call, I think next week. But anyways, hopefully you guys all saw it. It's always listed in the forum. And then the other announcement that I have is that Drainage Essentials and Bowel Complete will be back at the end of the month. I don't remember if we said that last week, but if you're wondering, I do think DSS still has stock though. So if you are out of any of those, that's where you can find them. What else? I think that's kind of it. We have a lot of questions on the forum from this weekend, so we'll go over those and get through those hopefully this afternoon / this evening, if not by tomorrow. So if you haven't had your question answered, it's coming. Chat. Oh, okay, yeah. If anybody didn't have, we're having our assistant still kind of help us with some outstanding billing payment kind of stuff, but if you have any questions about anything, let us know. But you should not be billed basically after this month. So this was the last billing cycle. And then that's it. All right. Let's talk about some teeth. I told Emily I actually coincidentally went to the dentist today. And last time I was there after pregnancy, it's very common. I guess I don't want to say the word common. It's like just accepted that you like have cavities because you literally gave away all your minerals, but not always has to be the case. But last time, first time around, I had 2 cavities after my first pregnancy. And this time they told me I had 1. But then I went back today and she was like, you know, because I told her I didn't want to do anything. It's not a holistic dentist and I still need to go to one. And I was like, I'm breastfeeding. I don't want to do anything. And she's like, you don't have a cavity. And I was like, wait, really? The other guy told me I did. And she was like, no, there's just some weird composite stuck on your teeth, probably from when you were a kid, like doing orthodontal work. I was like, well, this is great news. So I don't have any cavities. And today we're talking about oral health and teeth and eyes. And so it's very, very in alignment.
Good stuff. We got lots of stuff today. I feel like today's going to be probably a call that's brand new for everybody. What we're talking about. I mean, some of y'all might be like, oh yeah, I've heard that before, but this is like, even for Allie and I, like probably the thing that we know the least about. So when we dug into all the research and gathered all the info and asked my holistic dentist and went back through our notes of Lydia's call, there's just a lot of good info. So I'm excited. I had fun doing this one. And we'll talk about blurry vision. There's so much to this. I even learned this week that our vision can be impaired from emotions and trauma. And also I'll dive into it a little bit, but even like they've taken it out of schools, but if you are looking at something familiar, there isn't as much of an eye strain. So like Dr. Bates, he's done the research with it. And if you want to look up more, you can look up Dr. Bates Vision Children, but he'll have them look at a geographical map. And if it's something that they've seen in the past, their vision doesn't go blurry. But if it's a new map, their vision starts to go blurry, which is so interesting. We'll dive into that more later. So there's a lot of components that go into vision. And I'm not covering it in this one, but also if you have head trauma, car accidents, anything that involves the head or brain, because your visionary part of your brain is in the back, that can impact, I'm gonna turn on this light, that can impact your vision as well. So fascia work can be helpful for blurry vision too. So sometimes people will do fascia work and they're like, oh my gosh, I can see now. Whereas before they couldn't. So anyways, let me share my screen. I'll have the chat up as well. And we'll dive in. My grandpa said he exercised his eyes and he restored his vision. You can do that. There are eye-based exercises. And who was it that was doing a podcast on this? That they do work. Like you can do specific exercises for the eyes to help restore vision, which is super cool. All right, so we are going to start with eyes and then go into teeth and oral health. And I'm not going to read all this because really does it matter for us to know what the macula does? Probably not. But I think it is cool to know the different parts of the eye to start out. and it's broken down into different sections here. It does not list the sclera. The sclera, because I'm going to reference that later, is the white part of your eye. Also underneath the eyelid, when you see sort of the squiggly lines, those squiggly lines, if they have certain shapes or there's an abundance of them, or they're like red in color, that can point to parasites. That can be a parasite indicator. So if you're in front of a mirror and you kind of lift your eyelid up and look down, if you see a lot of those squiggly red lines in the sclera, that can be an indicator of Lyme, spirochetes, parasites, other types of root causes and infections. But these are the parts of the eye and the different structures and functions and such. And then with the eye, when people think the eye, they usually think blindness, loss of vision, right? You go to the eye doctor and typically they're looking at these main eye diseases, but the main reason that people even go is either I feel eye pressure or my vision has been impaired. So in the US, some of those main eye-related diseases that you're primarily going to hear about are macular degeneration, cataracts, diabetic retinopathy, which is a form of eye dysfunction that happens from diabetes. So blood sugar, massive role, both high and low blood sugar in vision, and glaucoma. In Chinese medicine, it's said too that the liver is what opens into the eyes. So your liver blood is what nourishes and moistens them, which is why Sjogren's, which is an autoimmune disease that tends to impact the liver, also tends to lead to lack of tear production and lack of almost like a softening where there's pressure in the eye. So dry eyes, pressured eyes, bloodshot eyes, lack of tears, that's an autoimmune response. And often the liver plays a massive role in those autoimmune diseases. So poor eyesight, poor night vision, those can all be due to liver issues. They can also be due to things that are impacting the liver and nutrient deficiencies. So what we look at, and I think that this is important to recognize, what you choose to look at and what you actually see influences your eyes. And the picture I like to kind of give people, or the analogy I like to give people, is often too, if you look for something, you're going to find it. And so we constantly need to be aware. And I know that's like, well, duh, but if you go for a walk and you're not paying attention, you may not recognize certain things in your environment, where if you go on a walk and you're like, I'm going to see butterflies today, you end up seeing the butterflies. They're all over. So your eyes are providing information for the brain. So if someone were to do, and this was also referenced in a podcast a long time ago, but if they were to just sit in a dark room with no light, remember light's important for our eyes too, and no exposure to the outside world, the brain's not going to be able to process and progress and grow in its ability to function. So what we look at definitely matters. Now, of course, people who are blind usually have a heightened sense in other areas, whether it's hearing or sensing, touching. So there are other aspects to that. And I'm going to ask if anybody, I'm going to come back to one slide, but does anybody look at this and one of the circles, can you not see the number? I'm just curious. I'm wondering if anybody in this group has borderline color blindness. Red and greens tend to be the most common. Yellow and blues are second common. But I'm curious, can y'all see all these numbers, or is there anyone who can't see one of the numbers?
Like can't see it at all.
Or
just like it's really, it's a lot harder.
This one's specifically for color blindness.
Okay.
So if one's like super difficult, that can provide insight into color blindness or certain colors. And this is one of the things they use, a chart like this, to detect that. Someone would always say, like, how did they know that they were colorblind? Like, how would they determine that? And it's things like this. So anyways, this is one of the things that they'll use for figuring out something called color vision deficiency. We hear it as like color blindness, which color vision deficiency is the inability to distinguish certain shades of color. So we just hear it as colorblind in our environment. But the reason that this happens, color vision, is due to photoreceptors in the retina, which are known as your cones. You've probably heard like, oh yeah, your cones in your eyes. Your cones have light sensitive pigments, and that's what enables you to recognize color. And then found in the macula, the central part of the retina, each cone is sensitive to either red, green, or blue light. Do y'all remember when I did the epigenetic call and the body type call? And I said, every person is either a red, blue, or green. And everyone's like, but I'm a mixture. Every single person is either a red, blue, or green. And it has to do with this. It has to do with the cone of the eye. So whichever one of those, red, blue, or green with the glasses over the eye, causes weakness in the body, that is the epigenetic body type of that person. And it's found through the sensitivity of the cones of the eyes. So it's all based on the wavelengths of things. So normally these pigments inside the cones register these different colors. They send the information through the optic nerve to the brain. That enables you to distinguish like tons and tons and tons of different shades of color. But if your cones don't have one or more light sensitive pigments, then there is an inability to see all of them. So most people, this is another thing that people don't understand. People think that when they're colorblind, they can't see colors. That's not the case. Most who are colorblind or dealing with color vision deficiency, they can actually see colors. It's just certain colors they can't see. So the most common one, like I said, is red, green. And it doesn't mean that the people with this deficiency can't see these colors altogether. They just have a harder time differentiating between them. So like Ali asked, like, can you not see it at all? Not necessarily. It's just that it's harder to differentiate those colors between the other ones. And it can also depend upon like the scale of darkness to lightness of that specific color. So it's almost like you look at it and you're like, ooh, I have a harder time differentiating that one specifically. And then the second most common one is blue yellow. So it's more rare. It's a more severe form of color blindness than the red green, but it's more rare. And the reason why is because people with blue yellow deficiency frequently also have red green blindness with it. So they've got kind of two in one there. But in both cases, they often, in place of that, will see neutral or gray instead of what the colors should be or what they should appear like. Those glasses, I don't think you can buy them. A lot of like chiropractors have them in their office that they get through their training programs. Okay, so moving on to the next slide. Why is it not letting me move down the list? There we go. Okay, so this is what I was saying earlier about your visual cortex is in the back of the head. Have any of y'all ever like slammed your head on the floor or like got in a car accident and your vision goes blurry? It's because of this, right? So your visual cortex is in the back part of the brain. 3 of my 7 concussions were on the back side of my head. They were from either colliding or slamming my head on the ground. And so because of that, I get up. And one of the things I always knew that I was dealing with a concussion is I started seeing all these like blurry, squiggly lines on either the left or the right side, depending on which part of the visual cortex got hit that was influencing the optic nerve. And so not only was my vision blurry, but I was seeing all of these like random lines on one side, which makes you super nauseous because that's another thing with your vision. If you can't see fully and it's blurry, that can lead to nausea. Remember, the eyes and the liver are connected. And so one of the biggest things that causes nausea is liver gallbladder. So the eyes can influence the liver can influence the eyes, which is super interesting. And they obviously have to go through the optic nerve. So anything nerve related, when we talked about nerves and nervous system, that also influences the health of the eyes. When you look at Chinese medicine, the different parts of the eyes are correlated to different organs. So the pupil would be the kidneys, the iris would be the liver, the upper lid would be the spleen, the lower lid would be the stomach, and then the sclera, like I was talking about, the whites of the eyes, that's the health of the lungs. You'll also tend to see, and then the inner areas are the heart. You'll also tend to see that with the liver as well. A really good example of that would be jaundice, where and this happened to me, where the sclera of the eyes turns yellow when the liver or gallbladder is stressed. I also was curious because when I read scripture, I feel like eye and heart shows up so many times. And so depending on the version you read, it might vary some, but eye is used 116 times. Eyed is used twice. Eyes is used 501. I think in the King James Version, it's 502. And then eyes is used once. So very interesting. And they're clearly important. If you go and look at all the verses of where eyes show up and looking at things and how that impacts the body, it's pretty fascinating. So some common indicators of eye issues: poor or blurry vision. That's probably the most common, where people are like, something's up. Eye pressure is another big one. And I've been diving into this because I have a lot of people who've reached out saying, hey, I've got eye pressure out of nowhere. My family has eye pressure out of nowhere. This doesn't run in our family, and it's happened since COVID. They weren't vaccinated, but I do think, and when you look at the impact viruses have on the eye, I do think COVID is causing eye pressure for a lot of individuals. And sometimes you won't feel it. You'll go to your eye doctor and they're like, hey, your eye pressure is significantly, I don't know what scale they use, but it's progressed in a way as opposed to the pressure in your eyes that's healthy from the past. Bright zigzag lines, that's also common with head trauma, car accidents, that you see those. Clouded, hazy, or dim vision, double vision, fading of colors. And then dull and clouded eyes is usually worry and angst related. Think about even like dullness of eyes. Like if you're seeing dullness, imagine like on the inside what's possibly going on. Red eyes, bloodshot. We can see that with kids a lot if they're exposed to allergies or with high histamine, the outer parts will start to turn red. Eye floaters, that's a very common one we hear about. This is a combination of liver, adrenals, parasites, or mold. Dry eyes usually is liver, like we talked about, or the autoimmune response like Sjogren's, lack of tear production. Eye styes, these are usually bacteria. Strep and staph are very common for those. Yellow eyes, poor liver. Dark circles under the eyes, this is usually kidneys/gut or anemia. Iron anemia, which is usually parasite related because they eat up those iron stores. Eye twitching is usually a need for minerals. If it isn't minerals, it's poor posture or a need for chiropractic care. Remember also, like, your eyes and your skull and your spine are all connected. Everything's connected through that brainstem. And sometimes a shifted C1 or C2 can lead to optic nerve dysfunction and lead to twitching. So minerals, potassium, especially if it's on the left eye. I don't remember what the right one is, but the left eye is potassium. And a lot of people don't get enough potassium. That's a big cause of eye twitching. And then another cause of eye twitching that I researched this week, sorry, I didn't put it on the slide, is blood sugar. I know we talk about blood sugar and its role, but if you look up blood sugar and eye twitching, you're going to find a ton of correlations between those. If you want to write that note down, so I forgot to add that. For quality vision, that's why balancing blood sugar is going to be huge. And we also need to be able to increase blood flow. If there is a lack of blood flow to the brain, not only do we have brain fog, but we tend to also have poor vision. That should also say HemoGuard Supreme, not HempGuard, because that increases oxygen, that increases blood flow. It also is good at dissolving like fibrinogen, fibrin activity, which helps decrease inflammation. Because a lot of these, like when we get to the eye diseases here in a second, I think that's several slides away, they end in itis. What does itis mean? I-T-I-S, inflammation. So anytime you can decrease inflammation, you're going to enhance the health of your eyes. So culprits, lack of nutrients is big. We know, we hear a lot like, oh, this vitamin is my vision vitamin or the night vision vitamin. So nutrients and antioxidants are very, very, very important for the health of the eyes. Balanced blood sugar, very important. So high blood sugar not only damages the blood vessels in your eyes, it can also affect the shape of your lenses, which makes your vision blurry. And then acute short-term decreases in blood glucose, this is hypoglycemia episodes, have been associated with a variety of contrast sensitivities, dimness, blurred vision as well. It can feel like anxiety too. Parasites, these can cause floaters and that pronounced scurula under the eyelid, all those red lines that I talked about. Mold and their mycotoxins, these are a big issue for vision because they are toxic to cells. The term is cytotoxic. And then when they come in and, you know, when you're in a moldy building, a lot of times people will say like, hey, my eyes burn in here. They're getting really dry because those mycotoxins are interfering to the cells' normal function, and they cause inflammation, right? They cause those itis situations. They cause injury, which then creates vision problems. Lyme disease, this is a big one because of how Lyme impacts the nerves. It can directly affect vision. This is typically in later stages of Lyme disease, but this could also be floaters, blurry vision, eye flashes, double vision. Usually vision loss can be temporary, especially as you're starting I'm not saying y'all would lose your vision when you're detoxing Lyme. That's not it. But your vision could, decrease a little bit when you're stirring up some of these bugs and you're busting biofilms. And, remember, I'm going to show y'all here in a little bit with the oral mouth. Lyme can live in these cavitations in our mouth, Borrelia specifically, Bartonella. And not only does that impact the heart, right, but it also impacts our nervous system and our vision, and they're housed within biofilms and spirochetes. So you go and you disrupt that, it can get into the system and it can impact the health of our eyesight. Bacterial infections that can cause optic neuritis. Again, itis, keyword there, optic inflammation. Some strains of strep can also lead to infections of the eye that range from mild to those that threaten vision. So broad spectrum. Antimicrobial supports can help address that. Metals, cadmium is one of the biggest issues, but so is cobalt. I know it says chromium metal. This is like if it's the metal poisoning, but if your metal ion levels in your blood get too high, it can lead to vision loss. Viruses, so herpes, HSV, VZV, cytomegalo, CMV, these cause significant ocular morbidities as well. HSV is probably the most common one that affects the cornea, and that can lead to almost a clouding over the cornea, but many viruses are connected to eye diseases. So I'm sure COVID's not left out of that category. All the little infections in the inner part of the eye that kids can sometimes get, where it's like an eye infection, that's I can never pronounce this word fully. Allie, how do you pronounce that word?
Conjunctivitis.
Yeah, there you go. It affects the blood vessels in the membrane around the eyeball, and it can also lead to a lot of gunk in the inner part of the eyeball, crustiness. So when the discharge from the eye dries on the lids, so before crustiness, you have the discoloration. So you have pink eye, but you can also have like the yellow discharge from the eye, or, in pets, it's really obvious to see sometimes in the morning when they wake up. If it's white, it should be okay, but it's the discoloration discharge that could be, dry eye, an allergic reaction, or an infection of some sort. Okay. And yes, we will talk about breast milk in a little bit and how that helps. Okay, so I put this link on here that y'all can go look up. It just lists all the different types of most common eye infections that kind of goes more into pink eye, shingles, some of these other things that are acute threats to the eye. And then emotions. So we have several slides on emotions and eye issues. So the person who's really pioneered this is Dr. Bates. And he has been able to examine these eyes of his patients under I can't pronounce that word either, but it's the scope they use at the eye doctor to measure the refractive errors. So basically, how blurry is someone's eye? And he did this, he asked them to tell a lie, which I'm like, how did he even get to this point? But when they told the truth, there was not a change in their vision. But right as they began to tell a lie, the refractive error would exaggerate, the blurriness would exaggerate, which I think is so funny, because how often it's just in general.
That makes sense.
Right.
Like if you really think of like someone hooked up to a, what is it? Like when they do
lie detector?
Yeah, like a lie detector says. There's something called a something graph. I can't remember, for someone who listens to so much true crime. I can't think of it. But it's like the changes in someone's heart rate is what they're looking at. And so it's like if your HRV is elevating, if your resting heart rate is elevating, if your stress is being put out because you're lying, your cortisol, I mean, that totally makes sense why your eyeballs would be like.
Well, and glucose goes up too,
Yeah, think about,
Glucose
it's like a adrenaline kind of response. Yeah. A polygraph test.
Okay. Yeah. Never heard of that. So that's interesting. So basically lying, blurry vision, telling the truth, no change. Then he looked at the patient's eyes of school children, and he would once again measure the increase in the refractive error when they looked at something unfamiliar. So this is what I was saying earlier about the map. So let's say child learns the geography of the United States at the beginning of the school year. They're now familiar with it. When that child looks at the map of the US in the middle of the school year, there isn't a change in the vision. But the first time they look at a map of Europe or Asia, they may experience an increase in the blurriness. And the reason why is the mental strain that the unfamiliar map brings about. So going back to that first thing of like telling a lie, you're unfamiliar with what you're even necessarily saying. And they've also done research that if someone tells a lie enough times, they'll start to believe it. And so this is similar, right? It becomes their second nature. It becomes something that they're familiar with. So this is why Dr. Bates at the time recommended that all teachers have like a simple eye chart at the front of every classroom to act as the familiar object for all students to look at whenever being introduced to new unfamiliar objects, so that it can kind of balance one of them out. So if they are looking at something that they're like, I've never seen this before, they can glance over and look at the eye chart and it'll eliminate the blur. So that's fascinating to me. But the practice only lasted a few years and the eye charts were removed from schools. Lovely, right? So he has some questions at the end that he has people ask, like, have you ever lied to someone? Have you ever lied to yourself? Is there something you're still lying to yourself about? Can you remember how you reacted to learning new subjects and topics growing up throughout school? If you develop blurry vision later in life, maybe you had to learn things or take on new tasks or new responsibilities, or you advanced in your career and you were a lot was put on your plate, or you dove into continuing education or whatever it is. And he goes on to say that he has not had a single student who has not been able to discover or acknowledge some form of emotional root to their vision problem, and then goes into this next segment of having you take yourself back to the time when you first noticed a change in your vision or when you first started wearing glasses. So for me, this was fascinating for me to study because I just had to get glasses the end of last year, or maybe it was the very beginning of this year, one of the two, because I've had great vision my entire life. And all of a sudden, my right eye vision has started to decrease. And it was right around the time I was kind of dealing with a lot of stuff in my life. And so as I'm reading this, I'm like, yep, this, yep. So if you are nearsightedness, this can be at a young age between 5 and 10, but usually, and I am a farsightedness, that's my issue, that usually happens later in life. So nearsightedness early, farsightedness later on in life. Goes into more questions. Y'all can read those later on what to do. And then the very last part of this that's beneficial is crying. That's a necessary and beneficial eye exercise. The eyes are not only for seeing, as we know, they're also for crying. They're for surrendering to emotion. They're for releasing tears. There's also a really great thing on Spotify you can look up called The Gift of Tears. It's so beautiful. You'll bawl your eyes out to it. But our tears, and people have even said that like certain dysfunctions in the body can be tears you haven't cried yet. So it releases, right? That's a form of detox. We forget about that our tears are a form of detox. If you get something in your eye, what happens? Tears will develop and you'll start to have tears come out. So it can release pent up emotion, stress, worries, anxiety, strain. So if you grew up and they basically said, hey, never cry, hold all your emotions in, that can clearly impact your vision and like the way you see things later in life. All right, so eye supports. These are some of many. I just try to get ones that y'all are familiar with and ones that are multi-purpose so that you're not on a zillion supplements. So down at the bottom, because Jamie mentioned it earlier, and I'll let Allie speak to this more, but breast milk can be incredibly helpful for pink eye and infections in the eye.
I mean, I think the main thing is that like breast milk is so antibacterial, antiviral. It's basically like supporting baby and giving them immunoglobulins. You know, you're producing any antibodies that mom has is going to pass. The point of breast milk, and part of it is you're passing those antibodies on to baby. So that's why in some theories, I guess you could say, which I will be honest and totally disagree with, is that they say, oh, get this so-and-so jab for pregnancy because you're going to pass on your antibodies to baby. That's a whole different topic. That hasn't really been very studied, but we know that we pass antibodies on. To what degree and what extent is very specific. But so if your baby has some type of bacterial infection, viral, anything, like breast milk is just like the cure-all for literally anything, like cuts, scrapes, bruises. It's just so rich in so many different nutrients and vitamins and antibodies and things like that. That yeah, it can be helpful for so many different things. That's why also people say even if it's old milk and it's like 6 months plus, of course it's gonna over time be less potent, but like don't toss it. Like you can save it and use it for like bath. So like it's great for like skin support and eczema, put your milk in the bath and throw your baby in there if it's got eczema, things like that.
Yep. So
Yeah, no
breast
kidding.
milk is helpful. And like you could use your own breast milk if you get a pink eye. So it's pretty cool.
Yeah, I put it in my husband's eye before. He was not thrilled about it, but I was like, do you
It
want pink
works.
eye or do you not?
It works. I've heard it works. So does homeopathy, but breast milk, that's an easy thing you might have on hand. All right. So PC, another benefit to PC, really helpful for vision. There was so much information. It would have taken up a zillion slides. So I put the blog post that Body Bio wrote that breaks down how PC helps the vision. Vitamin C. So Camu, really good whole food source of vitamin C. Supreme Nutrition has a good one. This can play an important role in the eye and protect it against UV light. And goji berries. Goji berries also support the kidneys, which kidneys are the iris. So those are said to brighten the eyes. Antioxidants. So you hear about lutein often. Lutein's good. I really like Fair Supreme. It's got bilberry and some other good, really strong antioxidants in there. And then the other two supplements from Supreme that are good for the eyes is Vital Guard Supreme, which is broad spectrum, really good for viruses, which are like one of the reasons people could get red eyes, blurred vision, autoimmune, and Chase Tree. Chase Tree / Vitex is used in traditional Chinese medicine for eye health. Zinc, this may slow the progression of age-related macular degeneration. Your fat-soluble vitamins, A, D, E, and K. I don't think D is on here. I left it out, but D is also important. A is specifically for night vision and avoiding dry eyes. E protects the eyes from oxidative damage. Vitamin K prevents excessive vascular calcification. This can lead to the buildup of atherosclerotic plaques. Iodine, this has been reported to have positive effects on visual acuity. The liver, like we said, the liver and the eye are very connected. So if you support the liver, you're supporting the eyes. Homeopathy, lots on homeopathy tonight. We'll go over that on the next slide. Black seed oil. So black seed oil is what I use for almost every client I have with Sjogren's. And it's one of the only things that helps them with the dry eyes. You can go and research all the benefits of black seed oil, but two of the most common reasons I think it helps is it helps balance and modulate the immune system. It's also incredible for the liver. So that one's good. Taurine.
I wanted to share real quick, just like the case study that I feel like would be a good insert to this with my mom. Just for 2 seconds. So, because this is fairly recent, but so my mom has struggled with glaucoma for a really long time. She's seen 1,000 eye doctors. She's on 1,000,000 eye drops all the time. They always tell her her pressure is high. Her inflammation markers are always high with that. And so recently I just decided for whatever reason, actually I remember why, because she had antibodies for thyroid then pop up. So we knew it was autoimmune looking. And I said, I'm just going to run your ANA with reflex. I'm just curious to see what autoimmune stuff we pick up on if it's positive. And sure enough, her Sjogren's ANA came back positive and Sjogren's antibodies showed up. So that's why she actually has this pressure in her eyes, and the glaucoma is really because of this autoimmune Sjogren's. So the glaucoma, maybe she does have that, but it's coming from a buildup of inflammation and pressure. But what's also interesting is when Emily and I do a lot of cases like this together where I'm like, I can't like see things in family, so I always ask Emily, of course. And so my mom also had mono when she was in high school. And so she definitely has an Epstein-Barr virus underlying root cause. So going back to that virus component. So I'm sure having COVID and all of that, potentially could have flared. Maybe her eyes got worse then. I don't even know, probably. But so anyways, we have her on the black cumin seed oil in addition to a lot of other stuff to support viral load and the Sjogren's now, which is just all, that makes all the sense.
All connected. I know. All those little like moments. Yeah. Super cool. I think that's probably why COVID has triggered a lot of people's eye pressures get worse, because it's like waking up Lyme and these other infections, but viruses in itself impact the liver predominantly, and then the liver's connected to the eyes. So very interesting. Taurine too, which is in our drainage essentials and will be in our newest product coming out at a higher dose, is a protector for the eyes. So it sort of acts like a shield from light and chemical damages. Taurine is up there alongside B6 with one of my all-time favorite ingredients, because most people have bad gallbladders, and taurine is one of the absolute best things for gallbladders. And you can high dose it more so than things like TUDCA. And not everyone can tolerate TUDCA, especially if they have stones. So just for general bile production, I absolutely love taurine. That's why we put it in drainage essentials. Eye styes and strep. So if someone continues to get eye styes and boils, it usually correlates with things like strep throat, streptococcus in the gut. What impacts the gut tends to also impact the liver, impacts the eyes. So Morinda and Golden Thread are two like broad spectrum antibacterials that can help if someone has eye styes. And then we already talked about breast milk. So homeopathy, there's several different ways to go about homeopathy, but there are some for eye problems, especially when it's acute. Because with eyes, like if you have a lot of an infection in your eye or something that's uncomfortable, you're not like, hey, I want to spend months and months trying to fix this. Sometimes you do need acute supports. So these are some of the ones. I wish I would have known this in college, because I had partial, I don't think y'all know this about me. I had partial retinal detachment in this right eye in college from getting hit with a soccer ball so intensely to my eyeball. So I got rushed to the ER. They did all these tests. My entire eye filled up with blood. And it was not comfortable. It makes everything blurry, pressure filled, not fun. I had to wear a really cute eye patch for 2 weeks in class. I looked like a pirate, but it is what it is. And it would have been so nice to have something like this to help in an acute case. So these are just ones y'all can have on hand for dry eyes, or other types of inflammatory disorders. Okay, so that is eyes. We're going to move on to oral health. Not going to read this whole slide, but it came from Dr. Stacy's website. I linked more of her stuff at the end. She has an awesome website. She's a pediatric dentist, someone who I get a lot of information from. And she's been on several podcasts, and love her insight and information because she's all about bioindividuality. So lots of good stuff from Dr. Stacy. This is just information straight from her website about the oral microbiome. So we talk about biofilms a lot with you guys. And what we have to remember is biofilms are there for a reason, right? So with biofilms, with our oral microbiome, it's going to form that biofilm throughout the mouth, aka plaque, to create an ecosystem that maintains health in a state of equilibrium. Now, here's the thing about the mouth, and this is where a lot of people mess up when it comes to the mouth and the gut. If you wipe out everything, it's a problem. You want a certain level of candida in your body. You want a certain level of pathogenic parasites in your body. You want a certain level of things that, if overgrown, could lead to SIBO. And so in the mouth, when people use mouth washes and they brush their teeth too much and they try to just get rid of everything, that's a problem. You're going to disrupt the delicate balance and homeostasis of the mouth. So anything that impacts the gut impacts the mouth, and anything that impacts the mouth impacts the gut. So when someone's using mouthwash every day, what do you think that's doing to the gut? It's disrupting the gut flora as well. They're interconnected, just like the brain and the gut, the mouth and the gut are interconnected. So there are over 2 billion thriving bacteria, 700 known species in your mouth, where they habitate with one another. And they colonize the hard surfaces of the teeth and soft tissues, which is known as the oral mucosa. There's also something called, and this would have taken me way too long to explain, but y'all can look it up on YouTube. There's something called leaky gums. So think about that. If we have leaky gums, do you think we can get rid of leaky gut? No. If you have leaky gut, do you think you can get rid of leaky gums? No. They're interconnected. So this is where we have to be so careful about what we put in our mouth, what toothpaste we use, what water we drink. When you think about supplements, liposomal, homeopathy, it touches your tongue. It touches that under area of your tongue. Your body's going to start to absorb it. And so this is the issue with fluoride, is everyone's like, yeah, but it works topically on remineralizing the teeth. Well, systemically, there are plenty of studies and research that it leads to brain issues and brain damage. And they're putting fluoride in water and all this other stuff. That's why I think it's good to have whole house filter systems. because if you're brushing your teeth in that, you're basically getting fluoride down in your gut. And if that's the case, it's leading to problems. And normal dentists don't know that. But I think that here soon, fluoride's going to be banned because there is, I don't remember the name of the lawsuit, but it's the people essentially versus the higher ups on removing fluoride. So I have a feeling that in the next few years, we're going to see a ban on fluoride. Other roles it does. Yes. Traditional dentistry. Yes. Okay. So having a healthy oral microbiome can help reduce the risk of systemic diseases, cancer, COPD, RA, diabetes, heart disease, Alzheimer's, obesity, and even adverse pregnancy outcomes, whether it's preterm labor, miscarriage, low birth weight. A healthy oral microbiome is also key to the overall health of our mouth. So we can help prevent or address these diseases that end in itis, as well as cavities and oral thrush and bad breath, which is very common in people, respiratory style infections, tonsillitis, again, itis, inflammation of the tonsils, oral cancer, by creating a balanced, healthy, just like our gut, oral microbiome. Here are key nutrients. So vitamin C is going to be really important. This aids in the development and maintenance of connective tissue. It's also important with the formation of bone, maintenance of healthy gums and wound healing. It's also really important for the lungs. It strengthens your gums and the soft tissue in your mouth. It can also be protective against gingivitis in the early stages of gum disease and can prevent your teeth from loosening. Potassium, this improves bone mineral density. It works with magnesium, so that's another important mineral to prevent your blood from becoming too acidic. When the blood becomes too acidic, it can leach calcium from bones and teeth. And then calcium is very connected to phosphorus. If you have an imbalance of calcium and phosphorus, it can lead to cavities. If it goes the other direction, it can lead to kidney stones, but calcium is very important for building bones, providing structural support, hardening the tooth enamel, and strengthening the jawbone. Phosphorus, so we've heard about the word hydroxyapatite, and most people think that, oh, you just get it from toothpaste. Yes, you get it from toothpaste, but with minerals, it's made in the body, right? It's a structural component of the bones and tooth enamel. And it happens with a balance between calcium and phosphorus to create the hydroxyapatite. I think that our enamel is made up of 97% hydroxyapatite. So when people are like, I don't want the Boca or the Risewell toothpaste, it's too expensive. You're paying for the hydroxyapatite. It's a very expensive ingredient to source. And that in itself is like a supplement for your mouth. So it's absolutely worth the price difference of paying the however much Boca and Risewell costs versus like the $4 to $5 toothpaste at the grocery store. And then your fat soluble vitamins, A, D, E, and K. These are very important just for immunity, saliva, mucosal membranes, preventing dry mouth. Because if we have dry mouth, it's reverse, right? This is why mouth breathing is a problem. People think like, oh, in a moist environment, bacteria is going to grow. It's opposite in the mouth. When you have a dry mouth and you're mouth breathing, it disrupts the delicate balance, and that's what can actually lead to problems. You want a moist saliva-rich mouth. Vitamin D helps your body absorb calcium. Vitamin E, this is good for gums, immune, fighting bacteria, antioxidant. Vitamin K, this helps block substances that break down the bone. It also helps your body produce osteocalcin. This is a protein that supports bone strength. A vitamin K deficiency can also slow down your body's healing process. It's known as the one with clots. The K for clots, people are more likely to bleed with not enough vitamin K. So indicators, most people do not have a healthy mouth across the board for lots of reasons, but these are the indicators to start wondering if there's a problem. Number one would be bad breath. So this is a sign of dysbiosis. Gut dysfunction is going to lead to bad breath. Candida is a really common thing. Oral thrush could fall into this category where the tongue is either, you can look up even the tongue and all the ways it can be disrupted, but like if it's swollen or there's a lot of raised bumps, or if there is a white coating or a yellow coating or a pale tongue, these all point to issues. Cavities and cavitations, AKA a hole in the mouth. So these can stem from a weak tooth. It can stem from an imbalance in the pH acid. It can stem from pathogenic bacteria, biofilms, aka plaque buildup, which is a byproduct of the acid. So when we've talked about when you kill parasites, acid increases, ammonia increases, ornithine decreases, and now we have insomnia. Now we have pain and inflammation. We pee through our minerals. The mouth's no different. So you have pathogenic bacteria in the mouth. The byproduct of that is acid that leaches minerals out of the teeth, and it leads to a cavity. Mouth breathers, because of the way it impacts the pH. Some symptoms. So especially for kids, if you see them on a monitor, like twisting around or not able to get comfortable in their bed sheets, this is a sleep issue typically, or a breathing issue. If they don't have sheets, it's just that they're not staying put in the middle of the night. They're moving and tossing and turning. So tossing and turning in the middle of the night is another indicator of oral health issues. Usually with this, you need an airway focused dentist, because it could also be inflamed tonsils or the adenoids. Poor posture, right? The head could be too far forward. Cheek ties, lip ties, mouth ties, all of those play a role. Tight fascia. So a myofunctional therapist, a CFT therapist, someone who can help you get back to nasal breathing, which, going into nasal breathing, what do we know impacts the nasal cavities? Colonization of fungus, mold, parasites, candida. And this is why we're so big on keeping that nasal passage clear in y'all's detox protocols. Also jaw issues. Sometimes people need expanders in order for the tongue to properly go to the roof of the mouth. So orthodontists, and you don't necessarily, people always ask me, do I need a holistic orthodontist? I don't think so. Most orthodontists are going to operate in the same way. You just need something that's going to expand the mouth for jaw issues. Another indicator, if you floss and you bleed, that's a problem. That means that there's inflammation in the mouth, or there's a nutrient deficiency, usually vitamin C or vitamin K. Gingivitis can also be inflammation of the gums, where you lift it up and you see almost like red spots or sensitivity while bleeding there. And then that can lead to like gum diseases, right? A lot of them end in itis. And then ulcers. Think about even ulcers in the gut. It's an acid problem. So in the body, if we have ulcers, that there's probably a lack of iron or vitamins that are your B vitamins, or there is a acidic issue. So what I'm going to say next is probably not going to make very many people happy, but if you have mouth ulcers and canker sores, do you think you want to take fulvic and humic acid? What do y'all think? No. This is where people can have issues, and it can get worse if they're taking products with humics and fulvics. Cellcore's products, every single one of them has humics and fulvics. Every single one of them. The answer is not more acid in this case. This is where I do appreciate the work of, and why am I drawing a blank on her name? I have some of y'all on her cookbook. Oh my gosh.
Wild.
Terry Cochran. I don't agree with everything she talks about. She thinks that no one should ever eat chicken or turkey, all these things. However, her information on this topic and how a lot of people cannot tolerate fulvics and humics until the pH of their body is balanced is incredible. So I would look into podcasts by her, because that is so important. It's also why apple cider vinegar, not great for everybody. You got to be careful with some of these things. We got to remember it's still an acid, right? It's still an acid. So if there's mouth ulcers or canker sores, people say, oh, well, it's a virus. Well, viruses disrupt the acid of the body. We've got to look at that. That has to play a role. Her name's Terry Cochran, TerriCochrane. She's got a lot of good stuff. She's done stuff for Body Bio too. If you go back on Body Bio's, actually that's what I would do. I would go to Body Bio's Instagram and go to their reels and scroll down until you see the live they did with Terry Cochran, because I don't know if she spoke about this specifically, but you can hear her speak two things, but she uses Body Bio often. All right, so then we have sleep disordered breathing. So Dr. Stacy, who I mentioned earlier that I love her website, she does a lot of podcasts on this topic, on sleep disordered breathing. And as a parent, she said a lot of times, like, you'll put your kid down and you're like, okay, time for wine, time for dinner, I'm out of here, they're asleep. And she said, spend time, even if they're older, spend time while they're drifting off to sleep or they're asleep, paying attention to the way they are breathing. So when they are moving towards that, deeper to lighter, are they struggling to breathe? Lighter to deeper, are they struggling to breathe? And it could also be noises, right? Snoring. Snoring is one of the most apparent ways that they're sleep disordered breathing. Grinding at night. Now, some people will say, well, that's parasites. Well, again, parasites create acid. Acid, it disrupts the jaw, leads to inflammation. But snorting sounds, grinding teeth, even I think she talked about on the podcast, not even grinding, but just like if you see their jaw clenched a little bit, or if their mouth falls open or they start drooling and they're not breathing through their nose. And some of the sleep disorder symptoms can be, attention deficit symptoms, ADD, ADHD. And we have to remember why, right? Your nose and proper breathing provides oxygen. Remember, oxygen is information to the brain. Bedwetting, chronic allergies, asthma, if they are a mouth breather, snoring, swollen adenoids and tonsils, frequent headaches, grinding, waking up frequently, excessive sweating while asleep, restless sleep, nightmares, irritability, aggressive behavior, difficulty in school subjects, arrested growth, daytime drowsiness, dark circles under eyes, crowded teeth. Here's another thing that I want to make a connection with that I see a lot in this space is nightmares, right? Someone's like, hey, I got on IS4 or this mold protocol and I'm having nightmares all of a sudden. Why? Break that down in your head for a second, right? Where does a lot of this stuff live? The lymph, the tonsils, the oral cavity. And what did I say about biofilms? We're stirring this up. A lot of those IS4, IS-bar, IS-boost, they're tinctures, right? You're putting it in a water in your mouth and it immediately works. It's not like a capsule where it's going down to work in the gut. And so it's going to start stirring up some of those infections. If it starts stirring up some of those infections and it's in the nasal passages because the nasal is connected to part of your upper respiratory, that's going to probably cause some temporary inflammation. If that happens, that's going to cause sleep disordered breathing. If sleep disordered breathing happens, we now have things like nightmares. Now, some people will also say, well, melatonin gives me nightmares too. Well, again, melatonin is antiviral, antiparasitic, antibacterial. It helps all those things. You're stirring it up. So we got to start asking the question of, hey, why are these things happening? It's not that what you're doing is wrong, but why is it happening? And this is another big cause. So especially in pediatrics, Alexandra mentioned it too, like snoring can clear with the removal of dairy. Dairy can create a lot of mucus and it can be very inflammatory for a lot of kiddos, especially if there's a sensitivity. So removing gluten, dairy, food sensitivities, that's a big one. Another big one is tongue and lip ties. So from a baby's perspective, this could look like reflux, colic, difficulty latching, gumming or chewing on the nipples, really gassy, not able to gain weight, making clicking noises while sucking, excessive drooling, choking on milk, or popping off the breast to kind of gasp for air, inability to latch properly. And then in the mama, you may see cracked, blistered, bleeding nipples, plugged ducts, discomfort while nursing, sleep deprivation, thrush, mastitis, compromised milk supply. And then these are just symptoms in children. So picky eating is a big one, food and texture aversions, choking, vomiting, gagging, food falling out of the mouth, using fingers to move food. I think that meant move food, not moving food. Move food in the mouth, pocketing food in the cheeks, food getting trapped in the palate, speech issues, delay or a lisp, digestive issues, migraines, headaches, more cognitive type symptoms, enlarged tonsils. So a lot of these parallel some of those other ones with bedwetting, cavities, bad breath, ear infections, sinus issues, even spine. Going back to, again, if we have scoliosis of the spine, we have to ask why, right? You have to begin to ask why. Clumsiness, poor posture, high palate, or the tongue can't fully rest on the top. You'd be able to see that, or their tongue can't stick out far enough. A recessed chin. So if you've ever seen a child where almost like they don't have any sort of outer part of their face like a normal, that can also be another indicator of a tie. Crooked teeth and TMJ. TMJ is a really big one of jaw issues, ties, grinding of teeth. So tests, this is hard to do on our own, like blood work, right? We sometimes have to go outsource for testing for oral health. The cheapest thing you could do is, and this will only give you part of the bigger picture, is oral pH strips. You can order them from Amazon. And I put a link here. It's the instructions for how to utilize the oral pH strips, when to use them, when not to use them, how long after meals, foods that can interfere with it, but it's a really like long thing. So I put that PDF, or not, it's not a PDF, but I put that URL there so y'all can get it. And really any oral pH strips work. We did this in the NTA when we went through the program. And I think it has to be 2 hours after any food, correct, Allie?
I think so. Maybe even just 30 minutes or something. I mean, like water is fine, but maybe,
Yeah.
I don't know. I don't remember it being that long, but at least 30 minutes, maybe look it
Okay.
up. But
Yeah.
yeah.
And also in this article, it explains what you're looking for pH wise. There's some discrepancy, what pH is best. There's another good article by Dr. Jockers, and he has a slightly different pH opinion. So I would maybe look at both of those.
And like when we were doing it was for fatty acid status, right? Like
Yes.
that was the main thing, is like, so think about like, what does fat do? Fat balances your pH or helps balance that acidity. So if you had a super acidic, what did that indicate? It indicated that you had low fatty acid status. And so you needed to add more fat to your diet.
And I
But
will
then
say,
you get digestion issues.
when I was working in the office, because we kept the pH strips, I would
Yeah.
say 9 out of 10 people had a low pH. Like
Almost everybody.
almost everyone.
Yeah.
So it matters. It definitely matters. And sugar is going to disrupt pH. Refined and fermented carbohydrates disrupt the pH. Normal coffee will disrupt the pH. All these things are a constant threat to the mouth.
And then also to think about, like, people will also say, oh, well, I eat a ton of fat. Okay, well, it's a problem with your absorption. So you look at digestion. Is it a problem with low stomach acid because you're not breaking down your fat? Or is it a gallbladder issue because you're not assimilating the fat? So it's multifaceted, just not just eat fat, but kind of go beyond that.
Yeah.
That's a good question from Alexandra. Is urine and oral pH be correlated?
Jockers covers that. They'll be slightly different.
Cool. Okay.
One can swing one way and one can swing the other. Yeah.
Yeah.
Sleep studies. So you would want to explore this with a biological dentist. Don't do the one I did because your finger will come off. I was like, I never want to do that again. I ripped it off at 1 a.m. But there's certain sleep studies where it'll measure your oxygen overnight and it'll look at how you breathe through like electrodes. But honestly, an Aura ring can give you a ton of insight. So to show y'all how many people, and myself included, don't do great with oral health and proper breathing mechanics, your REM sleep should be close to 35% every night. I'm like, I thought I was doing pretty good, and mine hovers like 25 to 30 on a good day. So REM sleep is a great indicator of oral health, breathing mechanics, all that. So it should be close to 35%. Now, if you wake up by an alarm super early in the morning, you're going to have disrupted REM sleep because those hours in the morning are pivotal. But an Aura ring can give you, even with your respiratory rate, a good insight. But sleep study for biological dentist. And then for testing Lyme in the mouth, I've used the DNA connections with several clients. You use floss. If you have a tooth pulled, they'll use the tooth as well. And I think there's also options with blood samples. Granted, it's not 100% accurate, but you can, I mean, if you're using floss and you're breaking up the plaque, like you'll be able to see what's in your mouth, what's going on. And then with dental cavitations, I have a lot of information on cavitations in the next few slides, but the best way it's diagnosed is through a 3D cone beam scan. This is the current standard of care that can identify jawbone abnormalities, but the key is that someone knows how to read it. I would not have someone read it that doesn't also do surgery, because it's like blood work. If you have someone that's looking at a cone beam scan and they're looking for just the things that are bolded, they're gonna miss things. So even if you've had one in the past and they're like, yep, you look good, I would make sure you get a second opinion. I would have someone look at it who truly knows what they're looking for. I'll show you all a picture down below. It can be deceiving. It can be hard to pinpoint. Dr. Mays out of Connecticut is one of the best. I know that several people have gone to someone in one area of Texas that puts a lot of good information out as well, but they'll want to examine it from like a deeper root cause lens and interpret it. Another tool. So we talk about thermography. Love thermography. Thermography will show you areas of your mouth that are either blocked or hot, and that can point to an infection before a cone beam scan ever does. And thermographies are pretty cheap. They run anywhere from, I think, $150 to $300. Sometimes you can get them from cheaper. But I've had a lot of people do that. And then that's what led them to a cone beam scan, because there was areas in their mouth that were disrupted and they found cavitations. And then the bottom part, assessment from a biological dentist, airway and sleep issues. That's another good article that I would read and look at. In fact, I might actually, I'm not going to go through it with y'all, but there are, in that article, there is the things that can lead to airway and sleep issues. So more like signs and symptoms, that I didn't cover earlier, as well as signs of having airway issues. It could be even things like chapped lips, how to detect it, dental related airway issues, sleep disordered breathing signs, yada, yada, yada. So that's another good article that was just a lot of good information. Oh, I did put a slide on here about the pH. So your oral environment pH, 7 is considered a neutral pH. But your saliva, a healthy range is between 7.4 to 7.6, slightly higher in children. Now, it's also interesting because the oral pH in athletes is usually bad. I have a slide on that in a second because of the inflammation. It's also usually bad in people who have higher body fat percentages, because this was so wild studying this week. Oral pH reflects the body's ability to store or to burn stored fat for energy. When I learned that this week, I heard it in a podcast, it blew my mind. And so literally your mouth matters, like especially if people are struggling to lose weight. If they do that pH test and they're too low, they're going to have a hard time tapping into fat stores. And if there's any sort of inflammation, right, like tendinitis, arthritis, colitis, that can stem from, contribute to the bad bacteria in the mouth, the low oral pH. So that's a really cost-effective, cheap way to test the mouth pH. The acidity of the saliva is those little strips that you do, turns a certain color, and you compare it to the chart. This was also surprising. Allie has a background in gymnastics. I have a background in soccer. My mouth was a disaster after college. I had 7 cavities after college, and I'd never had any pre-college. But all human performance, physical or mental, can be affected by poor oral health, and like vice versa. So low salivary pH can promote tooth decay, which is associated with reduced fat burning. And this specific doctor tested the pH of saliva in almost all athletes, and the relationships between low pH injuries, poor performance, and reduced fat burning was clinically evident. And so overall, athletes tend to have surprisingly high levels of cavities, dental erosion, poor oral health. But think about that. Athletes are in physical conditioning. They're sustaining injuries. Any sort of inflammation in the body is going to lead to inflammation in the mouth, and vice versa. So I heard that. I'm like, well, yeah, my body was a complete train wreck after college. I was inflamed. I had injuries, stress fractures, like all the things. No
But
surprise.
also, like, think about how, like, you're not running down the soccer field with your mouth closed breathing, right? You're breathing
open.
with your mouth open. And so
Open.
it's the same thing as almost like sleep apnea, and having all that bacteria, plus the thought of, like, I mean, soccer specifically, because my husband played competitive soccer as well. But think about like the glyphosate and all the things on fields, like gymnastics. I mean, yeah, I probably breathed in a lot of chalk. I don't even know what chalk is made out of. But like, at least gymnastics, you're not necessarily like mouth breathing while you're doing stuff. But like soccer, basketball, I mean, you probably slow down one of those clips. You probably don't see a lot of athletes being like,
No.
you know
No.
what I mean?
You're breathing through your mouth. You're sucking air.
Yeah.
So I found that so interesting. I'm like, no wonder I had so many cavities
Yeah,
after.
that's really interesting.
Bad breath. So these are just a little slide on causes of bad breath and the correction. So I'm going to start at the very bottom. Any carbohydrate in the mouth can ferment and reduce the pH and lead to acid. So I floss every day. If you do not floss every day, today needs to be the very first day you decide to floss every day. Because here's the problem. When you brush your teeth, you are not going to get, I don't care how good of a teeth brusher you are, the little tiny crevices in between your teeth that floss can only get. If there is anything left in those areas that you haven't flossed, it will ferment. Any carbohydrate will ferment. And if it ferments, it's going to reduce your oral pH. It's going to cause poor oral health. Especially like, think about how many people chew gum that has sugar in it. That's like, no, 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 no. Because those polysaccharides are going to go and wedge themselves, they're itty bitty into the gums, and they're going to ferment. But this is also mouth rinses, sports drinks, fruit juice, and especially right before bed. So be real careful. I know a lot of y'all are moms with gummies. A lot of times parents will give their kids gummies. Well, those gummies are going to get wedged up in between those child's teeth. And unless you're flossing like a boss, then it is going to ferment. And yes, so here's another thing with goldfish, Cheez-Its, fruit snacks. They're some of the worst things for kids to eat because they're going to ferment. They're going to wedge themselves up. They're also designed by food scientists, learned this week too, to specifically be addictive, where they'll get to the end of eating the goldfish or Cheez-Its and still be super hungry. A, blood sugars all over the place. B, you crave what your last meal was. Think about that for a second. You crave what your last meal was, or the last thing you ate. So if you're like, oh, well, I ate a good meal, but at lunch I had fruit snacks, and it's wedged up in your mouth, you're going to continue to be craving sugar. You're going to continue to crave these things because the body's smart. So they design these foods to continue to be like cravings for people. And then they go to the dentist and they have cavities and they get the cavities filled, but it doesn't fix the root issue of why. So as you can see on the right, like, how do you correct bad breath? You fix the diet, right? Use good flossing techniques. Use something like an electric toothbrush. The vibration can help kind of break off the biofilms and plaque. I love a water pick. I do my water pick probably 4 or 5 times a week, and I do it in the shower. So when Allie did that post on habit stacking, you could literally put floss, get like a little thing that connects to your shower, and you can have your water pick and your floss, and you could do it while you're in the shower while the conditioner's in your hair. And that's you could do just the water. My shower is filtered. So I just literally hold up my little water pick. I fill it up with the water in the shower. I have my Oral Supreme from Supreme Nutrition. I add 1 to 2 drops, and I water pick in the shower at nighttime. And then it doesn't make a mess everywhere in your bathroom.
Can I tell you also that I went to the dentist after COVID. Like, I guess prior to COVID, I had been going to my childhood dentist in Pittsburgh. And anyways, I went too long during the COVID situation between going, and I had a bunch of cavities that I needed to get taken care of. And I ended up needing to get a deep cleansing, I guess they call it, which is pretty painful. They have to use like anesthesia. Well, anyways, I probably had that for a long time, but my normal old school dentist just wasn't that thorough. But this biological dentist, at first I thought she was ripping me off, but honestly, I have my entire life has always felt like there was like a cat behind my tongue, like that texture of a cat's tongue behind my teeth. It would drive me crazy, but it was plaque buildup. But like, even after the dentist, it never got addressed. And after the deep cleansing, and they actually show you on x-rays, like you can see the plaque under there, and then they clean out the pockets and now it's clean. But what I thought was so interesting, and I think Dr. Lydia said this on the call that you had her on, but I actually now have to go for every 3 months. Like 6 months is kind of like an arbitrary number, but with the plaque, they actually did like a time lapse video where they watched the plaque grow back, and it literally grows back more like 90 days versus like most traditionally we get them done every 6 months. And it's so true, because literally I'll start to feel like that buildup right behind my teeth, I think, for however my mouth is, or just the saliva that gets back there. But sure enough, I'll look at my phone and I'm like, yep, I have my appointment scheduled like next week, but I can totally feel it. So that's just something. I remember she said that on the call, was like, especially women, because we are dealing with being pregnant, and they tell you to like take less care of your teeth during your pregnancy, but actually then you finish your pregnancy and you have all kinds of problems. So
yeah, no, you need to take more. Hey, are you eating meat now, Emily?
Yeah, not a ton, but like a little bit, and definitely throughout the week. Yeah,
that's good.
But not a ton.
Well, I would continue to do that and like build up to tolerance, because that was another huge thing they talked about with teeth issues. Is anecdotally, all of these holistic dentists are recognizing that the people with the biggest mouth issues are vegans and vegetarians.
Nice. Yeah, I'm like so tired of feeling like crap that I was like, I'm willing to try it.
We
And also
love
you
meat.
said about low iron and ulcers, because Emily Sprully said that
And
ulcers
B
have been a thing.
vitamins.
And
B
iron,
vitamins.
yeah, iron and B vitamins for ulcers,
I'm
which
on
is
Happy Bees. I'm on PC.
Well,
I'm
and
trying to get
vitamin
my
A.
iron up.
And vitamin A, which is in like only animal products.
Mhm.
Retinol. Yeah.
Okay. I'm on it. I'm on beef liver.
Good.
Doing
I'm on
all the things.
Yeah.
all of these. Okay, sorry. I know we're going long tonight. I apologize, y'all. I'm trying to move through this fast, but lots of information. Okay, so cavitations, a few slides on cavitations, but these are triggered by blocked up blood flow to bone cells. So they can be caused by a variety of things that we'll kind of go more into in a little bit, but injury or trauma to the jawbone and even excessive use of NSAIDs. That's a common thing that can lead to cavitations, dry sockets, overheating bones. Symptoms, facial pain, phantom toothache, headaches, migraines, trigeminal something. These are potential symptoms of cavitations. Sometimes cavitations can be silent and not have any symptoms. They may not always trigger pain or swelling, but they can result in systemic health problems where you're just like, I feel like I'm on an uphill battle and nothing's working and I can't get better. Up to 94% of dental cavitations are found at wisdom teeth extraction sites. I don't know about y'all. I had mine out when I was in high school, and I feel like that's when a lot of people have them out. And so if it's not healing properly in that area, then it can lead to a dental cavitation. They're also, it's a broad spectrum word. And I always thought that like a jawbone cavitation was different than a dental cavitation. They're essentially the same thing. So they have different different ways to say it. There's also terms that are actual diseases for it, like CIJD or IBD, which essentially means lacking oxygen. And they can occur in any bone in the body. So a cavitation is referring to a jaw cavitation, but it can happen anywhere in the system. And there are a lot of things that can cause it. So one are, like we talked about, wisdom teeth or any sort of tooth extractions, any sort of surgery where you go in and they're doing work there, the bacteria that it causes. If it's not properly neutralized or adequately flushed out after oral surgery or extractions, it can cause a problem. Now, this is what I found so interesting as I've been researching all of this and asking my holistic dentist, is most people are not draining properly, which is why we make drainage such an important part of our foundation. So she's like, a lot of these kids who are getting, you know, their teeth removed and wisdom teeth removed, their drainage is backed up. And if your drainage is backed up, it will not flush out properly and it will cause a post-surgery cavity in that area for years and years and years that's continuing to release these toxic infection residues into the bloodstream, where it might take years before symptoms even surface. Another thing with tooth extractions is it has to do with the periodontal ligament. This is what supplies the tooth with blood, serum, but upon removing the tooth, that ligament will die and reabsorb. However, if the body rejects the left behind periodontal ligament, the infection can occur. This is why mouth work is so expensive, because they could do a perfect surgery and your body could reject the left behind ligament and it can create an infection in the jawbone, aka a cavitation. Root canal infections. So the root canal teeth no longer have an active blood supply. So in the biological and holistic communities, this is referred to as like that lack of oxygen, necrotic teeth, because the tooth is dead. There's no blood going to it. So depending on the strength of the individual's immune system, it can lead to secondary infections. Other sort of infections in the body are just overall a lowered immune function. So it's been documented that many surgeries that resolve cavitations, when they went in, this happened to my friend Candace, they only saw a few on her cone beam, but when they surgically went in and opened it up, it's like festering hole in the jaw. They observe all of these other things that were not visible on a cone beam scan. And there's a video on YouTube I'm going to show y'all here in a second of what Lyme and spirochetes and parasites can look like under a microscope. And that's what's so scary about it, is it can be overgrown in a cone beam scan, doesn't even pick it up, but they're verified through things like biopsies. So again, mouth, gut related. If you have parasites, fungus, viruses in the body, it's probably going to happen in the mouth as well, vice versa. And then vitamin levels, ineffective immune system, Borrelia. So vitamin D3 is big. If we are low in D3 in our bloodstream, there's a really good chance we're going to have mouth oral problems because of its role in the teeth and calcium balance. That's a very, very, very important vitamin. And I know that a lot of people in our space are like, it's a hormone, you shouldn't supplement. I don't agree with that. I haven't agreed with that from day one. I think that there's a time and place, as long as you're checking your magnesium levels or supplementing with magnesium alongside it, and you have the cofactors A and K, and it's not a 10,000 dose every day, I don't think it's a problem. I've taken for 6 years, because Dr. Ozzie and Dr. Bob Rakowski are so big on vitamin D, anywhere from a 500 to 1,000 IUs of vitamin D every single day with a K2 in there. So I'm a big, big, big fan of it. Okay, so here's what it looks like. This is a 2D dimension of a 3D cone beam scan. So you can see that there is the cavitation, and notice how it's so subtle. Y'all, look at this. If I scroll in, if you're looking at this and you're not a dentist, you're like, where's the infection? When I was speaking with a dentist about it, they're looking for changes in colors, or like almost like a pattern that looks like a river that winds, where there's disruption, there's lack of flow. So my holistic biological dentist, one of the tests she does is an electrical current test. And so they'll put it in one side and they'll measure how long it takes to get to the other side. And based on that, they can tell if someone potentially has a cavitation or infection, because it's all about proper blood flow and the supply of it. So a lot of times, she said, dentists aren't even able to recognize the infections in the mouth. So those are the cavitations, those two areas. This is the large root canal infection right here. This was a failing titanium implant, and you can see the inflammation on both sides of it. Y'all can kind of see the color change. They circled it in red, but if I scroll in, see how there's different colors here? That's showing that there's inflammation. If you do an x-ray, if you ever broke a bone, you'll see the inflammation around the bone break. This is the root canal right there. And then over here, here's a root canal infection. You can tell based on the color change right here. And then there's 2 more cavitations. So also, where do you think, looking at these locations of the cavitations, where do you think they came from? Wisdom teeth, right? Your wisdom teeth are behind those molars. They get removed improperly or don't heal properly, and then a cavitation forms. And it can back the nerves, can lead to all sorts of issues. So treatments for it. There's a lot of discrepancy on treatments too for things. Laser therapy, very important. If the biological dentist does not use laser therapy, I would probably run the other direction. Laser therapy is really, really, really important. The second one that's very important is ozone therapy. So those are 2 really important things to look for when you're trying to find a biological dentist or have someone assess things for you, is that they have those in their office and they use them. Go to the next thing, homeopathy. So this is new to me, learned this not too long ago on homeopathy for cavitations. Can I say that I've seen a client do this instead of surgery and it worked? No, haven't seen that anecdotally, but it would be interesting if someone wanted to try it. Let's say they can't commit to a surgery right now and they know they have jawbone infections or cavitations. This is the protocol for that. And then someone could then go back in, take the remedies for a few months, reassess with, I would not say an x-ray, but a cone beam scan, and compare the 2 to see if it improved it. Because each cavitation is going to cost a significant amount, and sometimes you can't do them all at once. So even if you could reduce the amount of cavitations present and get rid of the things like Lyme, strep, viral parasites that caused them to begin with, or played a role in them, that would be really cool. And here is a sample schedule, what to look for in a surgery. If they don't have something along these lines, I would be very wary of it. Because remember what I said earlier, you could have a perfect surgery, but your body could reject it, or there could be an issue in the healing process, which is where these ozone injections and ozone insufflations are so helpful paired with the homeopathics. So there should be some level of prep work that's done. There should be some level of ozone injections with the Procaine prior to surgery. This is what I'm doing right now. I'm not getting surgery, but in case I have any sort of things left over from my wisdom teeth. That was what I was talking about with y'all last week of the shots. It's the Procaine followed by the ozone, and the ozone follows, and it kind of acts like Pac-Man for all the bacteria and stuff in there. And then the homeopathics afterwards. And then as long as you're draining properly, your body will handle it. If you need surgery, it'd probably be after the first or second set of the ozone injections, cavitation surgery, and then you follow it with IVs and ozone injections, and then some offices will offer biomodulation and infrared therapy as well. So that's sort of what it would look like if someone does have a ton of cavitations and needs it addressed and needs surgery. After the fact, homeopathics can be helpful for wound healing. So someone said earlier, antibiotic therapy. So Pyrogen 200 acts in homeopathy like a general antibiotic in cases they use it where like fever continues, but also it can be really helpful after surgery, weeks after, so that the infection does not respond. If the infection does not respond to the antibiotics, because remember, things like Lyme and various parasites are antibiotic resistant. And so if you have wounds in your mouth and there's a leakiness in your gut or gums, you kind of want to have additional support there. And then I think this one at the bottom is just a secondary support, HFR60. Oral health supports. So if you're going to chew gum, xylitol, the ingredient xylitol can be good for the mouth. Avoiding processed carbs, lots of prebiotic rich fiber, brushing teeth twice daily with hydroxyapatite based toothpaste, floss and or water pick daily, using an electric toothbrush, oil pulling, tongue scraping, and then more on homeopathics in a little bit. So this is another thing I learned this week. You should not brush right after you eat. You should always wait 20 to 30 minutes. And the reason why is because this allows the saliva to buffer. And the enamel, it allows the enamel to remineralize before brushing. So it's interesting that when I heard this, I was like, that makes sense, because there's people I know in the past, like, I don't understand. I brush my teeth after every meal right after. They're disrupting the pH of the gut. Your saliva has a very important role for buffering the enamel and remineralizing. So wait, like after dinner, I wouldn't just go rush and go brush your teeth. I would wait significant amount of time, 20 to 30 minutes before you brush. And then make sure you use toothpaste with hydroxyapatite. Proper airway nose breathing. Some of this we already covered. Ozone oil on gums. I use the Ella Oral Support on mine. Oral Supreme. It's right here. Has all these ways that you can use it. But tea tree, rosemary, peppermint, pomegranate. These are all really good at reducing black, helping with the gums, helping with bacteria, candida, strep, staph. CoQ10. This is really great topically. You can buy CoQ10 capsules, squeeze out the fat, and put that on your gums. It can help with inflammation. Normal breathing, mouth taping, irrigating pockets with ozone is one way that ozone can help. And it's another way you can wash your teeth. So it can be beneficial when a tooth nerve has been exposed. They'll use people will wash and swish around with ozone water. If you have an ozone machine at your house, you can make ozone water. There's also things you can do at your dentist where they'll make trays for you that connect to tubes to the ozone gas machine, and it'll run for about 30 minutes on top, 30 minutes on bottom. And that gas helps go in and support any sort of underlying infection underneath the gums, in between the teeth. And it also prevents the nerves from dying, which prevents root canals or extractions. You can also irrigate the surgical site with ozone. This will help speed healing. A lot of biological dentists do this anyways, but it can also help remineralize the bone. There's also injections, and this kind of falls in the neural therapy category, into the actual TMJ joint. This can be very therapeutic. It can help with the pain and the inflammation of TMJ if it's associated with something like bacteria, viruses, and fungus. If it's more so a structural problem, then it probably won't help. Cavitations, more on that, but O3 gas can be, that's what I'm doing right now. It can be directly shot through a shot into the cavitation site. Even if there isn't an infection there, if you suppose there is one, then you can do that. And last thing, when you're treating any sort of cavitations, make sure that you're draining properly and your lymph system's working properly. So I would not dive into any of this support if you have a stagnant lymphatic system. This is for tooth pain. Belladonna is great. Chamomilla is great. Those are two of our favorites. Before and after dental treatments, just some more homeopathic supports that you can use. Just because the nerves can be so impacted. Some of these are great acute supports. Leadum 200, that's good for discomfort from any sort of needles of anesthetics. I do not recommend lidocaine, but Procaine is good. Root canals, braces. So if you or your children have braces, here are some of the homeopathic supports for that, especially if it's causing them to just be really sore, or if the braces even damage the root. Dry sockets, wisdom tooth pain. You'll notice that chamomile and belladonna are kind of good across the board for every single one. And then this one at the bottom for nerve pain. And then cell salts. So with remineralizing teeth, hydroxyapatite's one way, correcting your oral pH is another, but another one is cell salts. You can get one that contains all the cell salts, Highlands brand I like, but you can also get the individual ones. So silica, calcifor, calcifos in the 6X form are really great. They're just these little pellets that you could drop in your water, and they help remineralize the teeth, prevent decay, strengthen the teeth. Love those. It's really also such a good option for pregnancy. So when people are like, hey, my teeth got so bad during and after pregnancy, cell salts, homeopathics, really good option. Really, really, really good option. And note that it says it needs to be taken 2 times per day for a few months to benefit from them. Those are some more resources. Okay, so let me stop this share and let me go to the video I wanted to show you guys online of these spirochetes. So my dentist does this. Some dentists have them, some don't. But you can, they'll take a thing of your mouth and they'll put it under this thing. And this is what you're going to see. Those wiggly things are worms. All those things are different. The rods, bacteria.
That's like in the gum?
Yes, in the mouth, oral sample.
Oh, oral sample, like a saliva sample or something.
Well, they brush it up against your gum, and you're like, they'll take the thing, go against your gum and also your tongue, and they'll put it under this.
That's not great. That's not great at all.
And she says that most people don't have proper oral health. So it's a constant threat. Look at all those.
I mean, it makes sense. It's like, well, how do they end up in your gut in the first place? Through the mouth.
It's so bad. Look at all of the worms squiggling around. That's not great at all.
That is not good.
I know. But way long ago, I think it just keeps showing you this, but yeah.
I've seen enough.
I know. But that's why way long ago, we showed you guys that thing from My Holistic Dentist of like water picking. Why I love water picking is you can add Oral Supreme and it goes in and helps create a healthy homeostatic environment in your mouth where a lot of these can't thrive. And then also think about in the gut. What do we always say with y'all? Why do parasites come back? There's 2 big reasons: stress and lack of acid balance. The mouth is no different. So when we're stressed, when we're not breathing properly, when we don't have an oral pH that's normal, these bugs can continue to thrive. So just killing them off over and over and over again isn't the solution. They're just going to keep coming back, releasing ammonia, causing issues, causing cavities, all the things.
Yeah.
So
Was that
yeah.
your last topic? Because I have one more if you just want to, it will be really quick, hopefully.
What?
I just put a link in the chat if you can click on it, if you can share your screen.
Okay.
So one thing that we didn't really talk about, I was going to add this in, but Dr. Rachel is she's a local cranial sacral chiropractor here, but she did this really interesting post on teeth straightening and her thoughts on Invisalign with like the whole body. Like you have to look at it. You don't have to, this is her perspective, but her thought is that you do have to kind of like assess the whole body. So I thought this was a really interesting thought and kind of way to look at this, because how many people have considered doing something like Invisalign without addressing the points of the body. So she says teeth are very large sensory point. They're in a specific place for specific reasons. Unhealthy patterns underneath, like cranial torsion, airway restrictions, infections, tongue restrictions, pelvis. I mean, everything we almost just talked about is basically what's influencing your teeth's position. So what happens if you just go and fix the teeth and straighten them without kind of taking into consideration like a whole entire full body alignment approach?
Yeah.
It's typically problematic because the reciprocal patterns weren't addressed. So basically it confuses the brain, or can confuse the brain. So if you have a teeth problem, you also have underlying patterns. Always manage the underlying alongside creating brain adaptation.
So
I thought that was
CFT
really interesting.
CFT therapy is one. Like I knew I did Invisalign or something similar. I was not going to do it until I got my spine fixed, because the reason my teeth went out of alignment is because my concussions caused my C1, C2 to go inverted, which pushed the tongue against these teeth and it disrupted the bite. So there is a root. Had I not fixed the chiropractic alignment, that would have done absolutely nothing.
Mm-hmm. Yeah. Yeah, I thought about doing Invisalign recently, and when I read that, I was like, okay. So it's almost like you can't just go straight to the end. It's like a roadmap. You can't go straight to the end of the roadmap and address viruses when you haven't done gut work and parasites. Same.
Same
So it's
thing.
like, guess I'll wait.
Yeah, last resort type thing if it doesn't go back into normal positioning. For sure. But even for kids, that's why so many need braces, is their structures off, their fascia's off, all that.
Mm-hmm.
Yeah. Cranial work, sacral work. Yeah. All of that's important. So everything's connected.
Yep. Shocking.
I know.
That was actually going back to the water pick. That was the one thing that Dennis said to me today. She was like, do you use a water pick? I was like, not as much as I should. She's like, you need to use a water pick.
I love it. Once you get in the habit of it, it just becomes second nature in the shower when like your conditioner's in your hair.
Yeah.
Yeah. Okay, so this was our last organ topic. We are going to send out a poll type deal or put a post in Practice Better for our call next week. Y'all can choose and vote on what you want it to be for our last weekly call. Or do we have two more? Or is it next week?
No, just next week.
Yeah. And then everything after that, because I know y'all have asked, will be monthly based calls. It'll probably be like just y'all can be grandfathered in until we get all of our stuff set up. Because that's going to take us a while.
Yeah.
TBD on that.
I've had a few people message us saying like this box was still checked and we can't download it. So I've tried to go and make sure that everything is downloadable now. If there's still something. One question actually, did you take off your hormone webinar from your website?
Yeah, because we updated, they have the most
Okay.
recent hormone stuff.
Okay, so yeah, someone was asking about that hormone webinar. That's no longer, it doesn't exist. Just go to the all education. That's where most everything is. Yeah. But everything else I double checked and kind of fixed. So you'll still be able to download stuff until the end of the month. And then you're all still going to stay in Practice Better. If your monthly payments outdated, I mean, we're going to assume that because some people we can see like was active a year ago, was active 6 months ago. We're just taking you off. If you, for whatever reason, decided to just join this call and see that, we're just assuming you're not participating anymore. So most everybody who's been active and up to date on their payments, everything, you're going to stay in Practice Better. You'll still have that link. Just a reminder, do not click in Practice Better, like book an appointment. That doesn't take you anywhere. You need to go into the module that says book an appointment with Emily and Allie. That's where the link is. And then you can book it on Wednesday mornings. Nothing changes. The other thing moving forward too, we also had a few questions or confusion around just when to do a call. Like when should you make an appointment with us? The best time to do that is if you're needing support with something specific. If you just did labs and you want them reviewed, we have to be able to have a call with you guys during an appointment and go over it because it just takes too long. There's too much that goes into it. We don't want to have any questions, confusion. So if you do labs and you want them reviewed, book a Wednesday morning appointment, whether that's an
exception to that, where we mentioned in the past, is we've had several people who are like in their second trimester of pregnancy and they're getting their HCG and progesterone tested. You don't need to book with us for that.
Right. If it's something super, super basic and we've had that conversation with you, you'll know. But if you're like, hey, I just did a Dutch test, can you review it? Yes, but please book an appointment because that takes a very long whole approach to us going over it, creating the protocol, all of that. Plus we have to look at it usually beforehand. It takes a lot of time on our end too, so.
Well, not only that, but there's times where like we need to know y'all's symptoms because you might present with low estrogen, but you're actually dealing with estrogen dominance, and we'll be able to tell based on your symptoms and the other markers and like what you're saying that you're dealing with. So
Yeah.
that's a big part of it too.
Yeah. And even just blood work, like we want to go over it with you guys so you understand it too. And it's not just us telling you, hey, this is what this says. Okay, bye. Like there's something that it needs a one-on-one for the most part, unless it's something very easy and super specific, like we said.
Yeah. Like if you're like,
Um,
"Hey, I got my homocysteine reran and it went from this to a this." No, you don't need to book with us. So
Right.
those types of things, you're good. But if you get a lab done, it's best in your best interest that we spend time going over it together.
Yeah. Because the more you learn it and hear it and ask questions, the more you can look at it on your own, run your family members, become your own self-healer.
Yep.
The group chat goes away, but we can still log into practice better. I mean, I'm not opposed, honestly, to keeping the group chat and the forum like open for now if you guys want it. I mean, we're not going to be adding anybody in, so it's really just you guys. I don't know that we're going to check it as often. But I don't know. What do you think, Is there any reason why we can't keep that?
I don't think it's a problem.
Yeah, I mean, I think it's
You're
fine.
asking us a question, I might not see it for weeks.
Right. We're still looking at like the individual chats and stuff, and I'll, look at it when we can, but so yeah, we can, okay, yeah, if you guys want it, then yes, because I know that there was talk about like, oh, should we do a Facebook thing? Like, that's too like complicated, and I don't want to like reinvent the wheel for another platform for you guys. Like, if it's working and you like it, we'll just keep it there. That's totally fine. So
Can I
yeah.
ask a question real quick?
Yeah.
Okay, so this is good timing. I went to my holistic dentist last week and they did what Emily showed, that sample in your mouth. And they found two things they were concerned about and wrote me a letter to actually take to my doctor, because they're saying if this is in your mouth, it's also in your liver and your kidney, I think they told me. And it was a amoeba of some type, and then of course spirochetes. So I know if I take that to my doctor, they're just going to be like, what is this? So I sent you guys a copy of it, and I asked what should my protocol be. I've had tons of crazy like MS like symptoms. I don't know, a big flare up. And last time I was there like 3 months ago, they did that test. They didn't find anything. Now it's all crazy stuff that they're like, we're really concerned. This is systemic. So do I need to schedule an appointment with you guys, or what do I do?
I would take Golden Thread Supreme because that's good for amoeba and fungus and liver and bacteria and parasite and gallbladder. Number one.
Okay.
Spirochetes, that's a broad spectrum for there's something that's a bacteria, but if they did not give you specifics, that doesn't help a whole lot. Does that make sense? Usually
they also had me do a saliva test called an HR5 test. I don't know if you guys have ever done that before, where you spit into this little tube and like your saliva is so high up, and they send it off to a lab, and it's supposed to test for like the 5 major like pathogens in your mouth. And I got that back today, and it was positive for 2 of the 5. And so I'm supposed to talk to them tomorrow for a protocol.
Which 2 was it?
It was Fusobacterium nucleatum and Tannerella forsythia. I don't know what those are, but I have the little card right here in front of me.
So Fusarium is ginseng. American ginseng covers Fusarium. What was the other one?
Tannerella forsythia.
Spell that.
Tannerella, and then forsythia, Forsythia.
That one.
I can send you like the chart thing. It almost looks like the mycotox test because the way they have like how much you have in your body, the thing they sent me. I can send it to you if you need it.
Okay, it's an anaerobic gram negative. Hold on.
While you're doing that, yes, you can still send us specific questions like this.
Artemisia. I would do ginseng, Artemisia, Golden Thread.
Is that all in one or 3 separate things?
Those are 3 different things.
Ginseng.
They're 3 different things for parasites and bacteria, and they cover those 3 cover those issues.
Okay, I'm writing this down. Okay, so I don't need to schedule with you guys for that. I just take these things.
Yep.
Okay, and would you send that to like a primary care doctor or no?
They're gonna look at you like you have 4 eyes.
That's what I thought, but that's what they gave me this letter for, because they say.
No,
your
no,
mouth, then your-
because here, for humor, you could go to your doctor and you know what they're gonna do? Here's a script for amoxicillin. Here's a
Yeah.
script for amoxicillin. That's what they're gonna do.
And you know why they gave you that letter in writing, which I was just listening to a podcast about this, is liability. They found something, they have to say, go to your doctor. Well, we told her, we printed this out and we gave it to her. We knew about it. So they have to for liability. They're
Yeah,
covering
when
their own ass.
when I had a little bit of bradycardia going on after I passed out, they're like, this is the referral for the heart doctor. You must go. And they call
Yeah.
to check in, and it's for a liability purpose. But they would probably literally, if you were to go to a doctor, give you amoxicillin.
Right, which I don't want.
No, I don't blame
What,
you.
what kind of oral support would you do? Just like dental side, the biocidin, stuff like that?
I don't love biocidin personally. In the mouth, I like Oral Supreme, and we have a sheet from our resource library of like what my dentist
Right,
created that we gave to y'all.
and I told them the peroxide part of it, and they're like,
Yes,
we don't
peroxide.
love using peroxide because
Yes.
it kills I don't know why, they just told me not to do peroxide.
Well, no, because they're probably not using the right type, but the bright one, the bright peroxide, where it's
Okay.
what's the percentage?
I use the 3%. Is it 3? It's a food grade
Just-
one.
You rotate it. You don't use it all the time, but like for time being, it can be helpful.
Okay,
Same reason if someone brushes with peroxide for a little bit, not long term, it will whiten their teeth.
okay. Well, I like the way it makes my mouth feel. They just told me not to do it all the time. So I'll go back to
Short term.
and get the resources and do that. Okay, that's what I needed to know. Thank you.
You're welcome. That's the benefit to knowing the exact bacteria, is you can know what herbs fix it, which is cool. And it's real time, whereas like bioresonance is not real time. It's anything you've ever been exposed to, you know? So that's super cool. Okay, do y'all have any other questions? Be on the lookout for that poll, because next week will be largely dictated based on what y'all want, whether it's a specific educational topic, a long Q&A, whatever, be thinking about it, and we'll post that and start creating information for it. Allie, you have anything else?
No, I don't
No?
think so. Tea stains.
Turmeric and coconut oil.
Turmeric, coconut oil, and then also I've been also liking the, what is the Organo toothpaste called?
Oh, that stuff's gold. OG Smile.
OG Smile. Although I will say I only use it at night because it makes my coffee taste disgusting in the morning and it doesn't leave my mouth for like at least 2 hours. So I've been
don't
using
notice
it at night.
I don't notice it at all. I love it.
It
I mix
messes-
both
I
up,
don't know.
mix it together.
But yeah, there's like reishi, it's great. Yeah, okay. Yeah, be on the lookout for the form will come through. I'm deciding how I'm gonna send it. If it's like a form that's like, I don't know. You'll see it though, but it'll be in the next few days.
Amazing. Y'all have a great week. We'll see y'all next week.
All right, bye.